A breast lift with augmentation is actually two procedures combined into one at one time. The breast lift is also known as a mastopexy, which is typically used to raise the nipple position or to tighten the skin of the breast. The augmentation obviously adds volume, typically with an implant. Because it's a combined procedure, we do highly select the patients. There are patients who we would not do it on because of risk factors, and the risk factors are really blood supply issues. When you're adding two procedures into the breast and you're trying to change everything in the breast, you're expanding the volume at the same time that you're lifting the nipple position and you're potentially tightening the skin envelope. Blood supply is the critical factor. So smokers, diabetics, some patients with very loose skin will tend to stage them or do them at separate times. But the majority of women who are healthy, who are young, that we see in our practice, majority of them can get a combined procedure safely. However, we do inform the patient it is a slightly higher risk for needing revisions because of nipple position issues or scars, etc. So it's a good option for women who have a deflation of the breast and a lower nipple position, frequently after childbearing. 2, 3 children often can be very detrimental on the breast. And so if they need not only volume, but a change in nipple position or a reduction in skin on the breast, then these are two procedures that can be done effectively. The breast lift and the breast augmentation do two separate things. A breast lift alone is frequently done, or a mastopexy is frequently done alone if the patient feels good in a bra, doesn't need to have more volume, and just has an elongated breast or low nipple position. However, the breast lift does not do a great job in augmenting the volume, especially in the upper pole of the breast, which is where a lot of women want to have some more volume. There are some techniques that can approach that. However, if the breast is already drooping, frequently the tissues will re-droop. And so the augmentation, and it doesn't have to be a large one, can be a small to modest size implant, can add some extra fullness or roundness to the upper pole. The two procedures do two different things, and so a woman who wants to be a little fuller or significantly fuller is going to need an implant or an augmentation of some technique.